I'd just like to let you know what the Lung Association does in BC. Our BC Lung Association's mission, we support people affected by all lung conditions, of course, including alpha-1. We fund vital research so that new treatments and cures can help save lives. We promote greater understanding of lung diseases. We advocate for positive change in lung health. Our initiatives now are the campaigns that we have for advocacy in this 3-year, from 2018 to probably later on. The campaigns that we're planning have been on asthma, COPD reimbursement, COPD reimbursement as well, that we're working with the government. Of course, you know about e-cigarettes, and vaping and cannabis is also one of the key things that we talked about because it just became legal. Quit Now is a smoking cessation program for us. It's free for all British Columbians, and we like to let people know that they can phone, they can text, they can talk to someone on the line, and it's all confidential. In the fall, like this fall now, we're looking at lung cancer and the Lung Month celebration. Outside, I have a Lung Month celebration poster and inviting everyone who are from BC all over the place. We're trying to celebrate the support of the community for BC Lung. So it's happening November 16 in North Vancouver. So please, if you have time and you can come, please talk to me after the presentation. For professional training, we do a lot of professional training. The respiratory trek was started in Saskatchewan and Manitoba, but all over Canada we have the respiratory trek training for all the allied health professionals, nurses, RRTs, social workers, pharmacists, and the others. We have modules on asthma where they can become certified respiratory educators. COPD is one of them, education module, and then we have spirometry. IPF is another program that the respiratory track is now open for registration. The BC Lung also has 4 times journal clubs that we meet with educators. Some of them have been my colleagues at the back who've been just finished their sessions. And also we have a Western video conference that happens 4 times a year. And that's BC, Alberta, Saskatchewan, Manitoba. So this is an allied health professionals workshop that we have, and it's available for all allied professionals. I run mine in the office with several topics. The last one was about lung cancer, or 2 days ago it was lung cancer. So interesting subject matters that we do. We also promote pneumonia and influenza campaign, of course, and we work with Ontario. We have our own promotions here in BC, but we also work with Alberta for all the influenza vaccines and Prevnar or the pneumonia vaccines. The patient support group we have the Advisory Patient Advisory Committee in British Columbia, where we talk and we ask questions on what the patients would like. So that's happening actually soon on November 27. We have the Better Breathers group. You've probably heard of them. We probably have 18 in the province where they meet from September to June, and we help them have speakers as well as community leaders to talk to the group. So they meet once a month, and we support their location. We pay for their snacks and things like that, but we also provide speakers and such for them. We have a step-up challenge that's happening for World COPD Day, and that's an example of an exercise program for the patients. And it will be, I think it's starting next week till after COPD Day. The educational resources of lung patients, we have a lot of resources that we can send you for your needs, and obviously you just have to call us to request for the materials. The Lung Association, as Dr. Marciniak talked about, CADATH, the P-coder submissions for patients' voices. We do a lot of submissions to CADATH about patient access to medications and such. So also meeting with them, sending submissions where it's like 5 or 10 pages to talk about new medications and what are the effects and side effects from patients on a patient voice concept. We have partnerships. Better Pharmacare Coalition is a coalition of 14 or 18 members of the BC public and stakeholders. We meet with them to advocate for the medications, for the access of medications for COPD patients, all respiratory medications that come up. We have partnership with the BC Alliance for Healthy Living, also in connection with the government. We have tremendous partnerships with pharmaceutical companies that help us with educational sessions that we do, just like what Alpha One is doing. We have medical and allied health professionals that we work with, and obviously we have a lot of certified respiratory educators in BC, very, very good resource for each one of the lung patients that we do. So the consultation and advice, it's coming up that we have a lung health strategy, specifically a voice for patients. We are very embarrassed in BC that we're a half province, but it's very difficult to access medications for patients in respiratory disease. We're trying to work with the government, advocate. We have a lobby day coming up, just so we can talk to the NDP as well as the Liberals and the MLAs that we advocate for a lot of some of the medications that have been here and have not been covered. In BC, we have at least 30 or 35 medications that are on the wait list for a long time. One of them has been here for 12 years. It's approved in most of the provinces, but not BC. We have difficulty, but we try to continually advocate for that kind of thing. So that's why we have 2 sessions to meet the government, one in the fall and one in the spring. So we're lucky to be scheduled for November 21st in BC. That would be part of the lung network that we're trying to do. Again, the patient's voice and advocacy is so important to us in that manner. We have fundraising activities. You probably have heard of the bicycle trek. It's a 200K. I don't expect you to do the 200K. It's 100K a day. It's a means of us to fundraise for the research as well as patient programs and such. Climb the Wall, it's the people that climb the wall are 768 steps. We use the Sheraton Wall Center. It's not outside, it's inside. You just go up the stairs and such. And some of the young ones do it in 4 minutes or so. Some of them even do it twice. So there's a lot of that. It happens in January. So if you're wanting to just come and see the event, you are most welcome. We usually have firefighters as well who carry their oxygen and climb the stairs. Yeah, they're just nauseous when they get up to the 48th floor. So in summary, as a BC Lung moves forward We are committed to patients and caregivers, and that's what we're trying to do for the next 3 or 5 years. Uh-oh. That means I'm up. I put my 10 minutes thing. It's not about waking up, but Angela said 10 minutes, so that I put my stopwatch. So, and as I said, commitment to the patients like you, and please don't hesitate to call us anytime. As Angela knows, and we are trying to work closely with all the other stakeholders for the benefit of lung patients like you. And we try to respect and understand the patient community perspective. Obviously, your voice is very important to us. We're expanding the access to medications and helping out also and being part of clinical trials for new and responsible clinical trials. In that, that means that we would, in order to do that, we're trying to improve lives and breath at a time. So thank you.